Acupuncture is only one of the many aspects of Oriental medicine. Other aspects include herbal medicine, bodywork, health-benefiting exercises known as Qigong, and dietary therapy. As knowledge and awareness about the value, validity, and effectiveness of Chinese medicine increases in the United States, we have the unique opportunity to incorporate it into the matrix of a newly emerging system of healthcare, one that may be able to much more effectively address the needs and ailments of the modern-day population. Western medicine has much to offer in the arena of diagnostics and emergency care. Oriental medicine has much to offer in the arena of helping people reach and maintain a state of health, and often providing effective solutions for situations in which Western medicine may only have drugs as an answer. Though the quality of emergency medical care in America is top-notch, accessibility of adequate medical care for the majority of the population is still a major issue. Much of the focus in the West is placed on the moment in time after a disease is diagnosed. But what sort of care, guidance, and options are available prior to that point? Rates of heart disease, diabetes, and cancer continue to rise, and many of the roots of these illnesses can be traced back to diet, lifestyle, emotional state, and environmental conditions. After the diagnosis has been made, Western allopathic medicine offers drug therapies to manage diseases such as these, and while pharmaceuticals can often perform an invaluable role and treat certain symptoms, they often can also leave the root cause of the illness unaddressed. In addition, long-term use of pharmaceuticals can in many cases be a tax on the internal organ systems and carry a long list of potential side effects. In many of these situations, treatment with Oriental medicine can not only resolve symptoms, but can also address the root cause of the illness while simultaneously strengthening and supporting the system in a healthy way. In addition, bringing Oriental medicine into the matrix of the healthcare system in America can potentially save us billions of dollars in healthcare costs. In a study of 105 patients in Denmark who suffered from severe angina pectoris, or chest pain, acupuncture and wellness education were administered in addition to the usual allopathic treatment. During a period of 4 weeks, patients received 12 acupuncture treatments. They were then observed at regular intervals over a 5-year period. The results were remarkable. On average, the group demonstrated a 90% reduction in subsequent hospitalizations and need for surgery. The average savings per patient was estimated at $32,000. No one will argue the invaluable role that Western allopathic medicine plays in emergency situations, but because Oriental medicine can help people maintain a higher standard of health, it can potentially produce dramatic cost savings by shortening hospital stays, reducing the time necessary for recovery, reducing rates of more costly interventions such as surgery, and often helping people avoid the need to take medications over long periods of time. And because of the distinct diagnostic techniques that acupuncturists use, they may actually be able to detect and treat internal imbalances before they appear as larger disease syndromes. True preventative medicine that could save billions in healthcare costs.
The role that Oriental medicine and acupuncture can play in the current medical field is that we would be able to take care of chronic condition, chronic illness. We would be able to take care of those patients who come back, and able to resolve the situation or resolve the condition instead of having to take medication over again or for the rest of their life. So for instance, for me, I am part of the Good Samaritan. So in a hospital, they'll come in quickly for whatever the acute situation they might have, and later on, they'll be able to come to the Department of Integrative Health here, where we can take care of the rest of it. So that will be some part that we can play within the current medical system. I hope that it will change in the future, though, that they'll come to us for certain things first, if they could. Obviously, acupuncturists or Oriental medicine practitioners, they wouldn't be able to quickly fix the bone, but would be able to quickly get to the post-operational care and get them to heal better.
When I think of integrative medicine, I like to think of a system where every modality is looked upon as having its own positives and negatives, rather than the hierarchical system that we have today, where Western medicine is sort of seen as being on top and other modalities are sort of ancillary extras, things that you might go to as a last resort. Western medicine is good at providing us ways that we can rule things out, things that could potentially be life-threatening. What would be a true synthesis, it seems like to me, is if we could say, having ruled out any life-threatening type of condition, just go straight to Chinese medicine, acupuncture, something of that nature. Why wouldn't you? That's a kind of synthesis that would be, I think, very beneficial for the patient, almost having the best of both worlds with that.
So what might this emerging vision of integrative medicine in America actually look like? A system in which Western allopathic medicine is one approach among many, with the emphasis placed on what will produce the best overall outcome for the patient. In most of the major hospitals in China, Western allopathic medicine and Oriental medicine are practiced side by side. In the United States, we haven't yet reached the goal of a truly integrated approach, but in the last decade we have seen a huge increase in general awareness about what Oriental medicine has to offer. Along with an exponential rise in the number of visits to privately practicing acupuncturists, there has also been a steady increase in the number of states with official legislation regulating the practice of acupuncture and Oriental medicine. As of 2010, the only states still lacking acupuncture practice acts are Wyoming, North Dakota, South Dakota, Kansas, Oklahoma, and Alabama. Increasingly, mainstream hospitals are also incorporating Oriental medicine into their integrative medicine approach. Some examples of well-known institutions include Sloan Kettering, the Cancer Treatment Centers of America, Massachusetts General Hospital, and the Mayo Clinic. One example of a more integrated approach can be found at St. Vincent's Hospital in Portland, Oregon, at the Providence Center for Integrative Medicine, where Oriental medicine plays a vital role in the approach taken toward patients who have a diagnosis of cancer.
The Integrative Medicine Program for Providence Cancer Center is an organization that was developed to try to bring the best of unconventional care, the parts of unconventional care that really should be part of conventional care, and blend it into conventional care. At least in our experience at this hospital, our allopathic colleagues were extremely interested, extremely supportive, and we looked for areas where we genuinely needed an improvement in care, which conventional approaches were not providing. In some areas, conventional medicine does a wonderful job. If you have acute appendicitis, you're not going to want a mustard plaster for that. You're probably going to want a surgeon. With respect to nausea and vomiting associated with chemotherapy, some of our medications do a wonderful job. For some people, they do a lousy job. So that's where we look for other opportunities. We've seen great changes in the sort of the philosophical discussion, the dialogue within the hospital with respect to healthcare since the integrative medicine program started, because physicians that previously had never accessed integrative techniques, now we're seeing from their patients' anecdotes that there was areas of benefit, and we have many patients who actually access our services, and nurses and other healthcare professionals who access our services, which is not surprising when you see your own patients improving. You're going to do the same thing.
What I've seen with regards to using acupuncture in the hospital here is that my patients have less nausea, less neuropathy or the numbness and tingling, less pain, less fatigue. And the oncologists like that, the other physicians that we work with, because their patients are able to do better on the protocols that they are doing. Over the past 5 to 10 years, we have seen a great increase in the amount of data or research on Oriental medicine, Chinese medicine, acupuncture, and showing that it improves quality of life for patients. It reduces side effects of medications and may reduce the need for medications overall.
I feel really blessed to be working for Providence for a number of reasons. One of the main ones is that I'm I'm able to work with patients who maybe otherwise wouldn't have come to a so-called alternative medicine practitioner. And I think they're surprised and gratified that these services are offered within a conventional model, so to speak. And so it demystifies for patients a little bit about what acupuncture and naturopathic medicine are about.
By using Chinese medicine and acupuncture in the hospital setting, we can serve more people and cut costs. And in this collaborative approach, I think that is vital to the survival of the healthcare system that we have here in America.
As you have seen, Oriental medicine is an intricate and dynamic system of healthcare, one which can offer effective solutions to many of the primary health concerns confronting people today. The principles of Oriental medicine can help you live a more balanced life so that your entire system is stronger, healthier, and more vibrant. And when disease or imbalance does arise, Oriental medicine often has treatment options that address the main symptom and also support the healthy functioning of your entire system. Hopefully this introduction to Oriental medicine has given you a better idea of how you can benefit from this ancient system of healing, and also how Oriental medicine can play a vital role in the emerging healthcare paradigm of the future.